Let's face facts. Engaging in habits of healthy eating and exercising, avoiding tobacco smoking, and making other choices known to be beneficial to health do not necessarily guarantee a life that will be free of the development of disease conditions. Though such practices are said to reduce the risk of conditions such as obesity, heart diseases, strokes, but when it comes to the development of most of these disease conditions, the causes and risks are multifactorial, from lifestyle to environmental to hereditary. For this reason, medical screening is a very vital aspect of your health, as it enables you to take actions before further complications of evolving disease conditions occur. And so in the next few minutes, I'm going to be discussing essential aspects of medical screening. Hi, I'm Dr. Francisca Osage, and thank you for joining me and Francisca on Health Matters. So the benefits of screening is to detect certain conditions that the screening method enables a detection for, while the condition is asymptomatic and can be controlled, to reduce the emergence of possible complications of the condition and, worse, death from the condition. So medical screening itself is a science, and there are routine screenings offered to certain age groups or individuals based on recommendations by various health bodies or associations. For instance, in the United States, you have the United States Preventive Services Task Force, the USPSTF. Screenings can also be recommended based on a person's unique predisposition to a certain medical condition, such as the presence of a positive family history or a genetic predisposition. There's also the consideration of the availability and affordability of the testing that's used for screening, and also the consideration of the available management and treatment options of the conditions that's been screened for. It is important to be familiar with factors such as family history. It could be the positive history in more than one close relative. There's the environmental exposure to toxins or pollutants or radiation, history of personal exposure to radiation. It could be from radiotherapy. So here's a brief summary of the routine basic medical screening, and this is for adults. So we start with the physical examination. So the physical examination is done very frequently during visits, and it is important because it primes the attendant to anything unusual that might warrant further investigation. And then there's the blood pressure measurement, and this is also done very frequently during clinical visits. And this is for the detection of elevated blood pressure or hypertension. Now, hypertension is a condition that can go unnoticed for years, especially because it is asymptomatic. And so when conditions arising from uncontrolled blood pressure start to emerge, it is very difficult to control. It has gotten to a stage whereby even control of the blood pressure will not necessarily revert the medical condition that has arisen as a result of uncontrolled blood pressure. There's a screenings for depression and anxiety recommended at least every year. And these are just a set of questions that can alert to risks or causes and prompt intervention when necessary. So we begin at age 21 with the pap smear. And this is recommended for females, especially females that are sexually active. This is recommended every 2 to 3 years, and it reduces the risk of cervical cancer. Now, cervical cancer is not a sexually transmitted condition. It, however, is affiliated with a virus that is transmitted during sexual intercourse, and that's the human papilloma virus. Now, this virus gives a high risk to the development of cervical cancer. Now, there are other associations or risks to the development of cervical cancer. HPV, human papilloma virus, being one of the very common causes to the cervical cancers. Then at age 35, there's the screening for diabetes, type 2 diabetes, especially in individuals that are overweight or are obese. Now, Type 2 diabetes is a condition that is also screened for in cases of newly diagnosed hypertension or hypercholesterolemia. In cases of pregnancy, there's the screening for gestational diabetes. So it's important to catch this condition to reduce risks that can arise as a result of uncontrolled blood sugars. These are risks that to conditions that affect the eyes, organs like the kidney, the heart, which ultimately could lead to conditions of stroke. It's the essential and the need to screen for diabetes to reduce the risks of these conditions that cause a huge burden to the individual. Alongside that, there's screenings for obesity, cholesterol. At age 45, there's the recommendation to screen for any abnormalities that could develop within the colon or the rectum that could lead to colorectal cancer, which is the fourth leading cancer and cause for cancer deaths in the United States. Although this is the age of recommended screening, however, if there's a positive family history, it is important to have that discussion with your primary care provider because there might be the need to have that colonoscopy before that age, and this is based on a positive family history. There are other conditions associated with certain kinds of colon cancer, so there's the need to be very aware of family histories. For men at ages 40 to 45, there's a recommendation for prostate cancer screening, and this is very essential, especially when there is a positive family history. And so that's a talk that needs to be done with a urologist or your primary care provider. The recommendation for breast cancer screening for women starts at age 40. However, a strong positive family history makes an exception to this and can qualify for screening for a genetic predisposition. Screening for tumors is done via ultrasound and or a mammogram. And at age 65, there's the recommendations for women for screenings for osteoporosis with the bone densitometry. And this option is also available for people placed on long-term steroids for different chronic medical conditions. Now, the impact of osteoporosis is seen, especially at that age of 65 and older, when one is easily prone to a fall. And with osteoporosis, the bones become very brittle. As a result, they're easily prone to fracture. So when the options for screening of these conditions are available, and also the availability of certain managements, there's a need to be proactive, make one available to screen so that the necessary managements can ensue. So other routine tests will include eye tests for conditions such as glaucoma. Now, based on lifestyle, there are also certain screening available. For instance, for people who have been chronically exposed to tobacco smoking, from ages 55 through 75, there's a recommendation to screen for lung cancers with the use of a low-dose CT. There's also a condition that is screened for, and this is called the abdominal aortic aneurysm, whereby the descending aorta loses the integrity of the wall and easily prone to rupture. This is dangerous because this could lead to sudden death. And so there's a screening for this condition so that there's early intervention to avert the risk of the complications of such conditions. Now, as one advances in age, at ages 75 and older, there's the need to consider the risk versus the benefits of certain screening methods. And so much more important are the screenings for home safety, fall prevention, the talk of screenings for cognitive decline, nutrition, abuse potential. These are very important aspects that need to be considered as we get to these age categories. Now, the talk of screening, both routine and individualized, is at the discretion of the primary care provider who is informed about one's personal history. And just because a test is available doesn't necessarily mean you avail yourself for that test, especially when not recommended by your primary care provider. And that is why there is no recommended routine ECGs or EKGs for the prevention of heart abnormalities. There's no recommended routine CTs or MRI for prevention of stroke. There's no recommended routine angiogram or Doppler studies for the prevention of blood clots. Apart from the unnecessary exposure to radiation or radioactive substances some of these tests predispose to, and also their high financial costs. These tests are typically done when there is a need to confirm or rule out, that is, exclude a medical conditions. They are done only when necessary. So alongside these screenings, ensure to maximize your health by adopting healthy lifestyle. Hey, eat right, exercise, be mindful, and avoid health risks. Again, I hope you found this informative and educative, and if you've had, please subscribe, and I'll see you in the next one.